I'm Betty Clark, and I graduated from the University of Virginia almost 50 years ago. My first job was a staff nurse on a neuro-orthopedic surgical unit. Since then, I've held many rehab nursing positions throughout my long career. I even started a part-time business 20 years ago as a freelance rehabilitation educator. In 2016, I retired from my full-time hospital position. However, I do continue to teach the rehabilitation certification courses, which motivates me to learn the most current knowledge available to manage rehab treatments and modalities. One major responsibility of a rehab nurse is to manage the patient's pain level. This enables rehabilitation interventions and treatments to be more effective and can encourage the patient to achieve higher levels of independence and function. There are many options to utilize, but a long-term pain medication can lead to both drug tolerance and addiction. Pain management is constantly changing, and with the widespread opioid crisis, current treatments such as Provant have emerged as a non-drug device to decrease pain, swelling, and inflammation. Well, around 2000, I was diagnosed with osteoarthritis in both knees. I started with a knee brace and over-the-counter anti-inflammatory meds, but then eventually needed stronger meds. In 2008, my orthopedic surgeon suggested that I have surgery to clean up my left knee joint. During this time, I was a nursing educator in a large 1,000-bed hospital that covered 3 blocks. Now, my pedometer recorded thousands of steps each day. Eventually, I needed more relief as my left knee started to swell and my pain increased. And sometimes I even needed to use a scooter. We tried cortisone injections, but they really were not effective. So in 2012, I had my first knee replacement. Along with physical therapy, I used ice wraps, leg elevation, and a continuous passive motion machine. I returned to work in 8 weeks using a cane and was on light duty for another month. I continued PT after work for 6 more weeks as my mobility was not progressing no matter how hard I worked on my home program and with my PT. My quality of life was altered because my energy only lasted for work and therapy. So this meant limited outings and fun activities. Ultimately, I was pain-free in my left knee. However, my right knee was beginning to need attention. And yes, I knew I was headed for my second knee replacement. Three years later, my second knee replacement was scheduled. I was not looking forward to the work ahead of me. A few months before my surgery, I met a Regenesis representative at a rehab nursing conference where she was demonstrating the Provant. I chatted with her about my upcoming surgery, and she suggested that I speak to my surgeon about using it. It was delivered to my home on December 26th. It was like a belated Christmas gift. 4 days after my surgery, I actually started a home PT program. When my staples were removed 2 weeks post-op, my surgeon was so amazed at my suture line. No redness and only a moderate amount of lateral swelling, unlike my other knee 3 years before. I used Provant twice a day, along with my leg elevation, my ice wraps, and the continuous passive motion machine. Within 14 days, my pain went from an 8 out of 10 to a 0. There's sometimes I needed a low-dose pain med just before my therapy sessions to push my endurance to a higher level of degree inflection. By week 6, all of the swelling had disappeared. Throughout this recovery, the bruising was exceptionally light and did not travel down my calf as it did before. I returned to work in 6 weeks this time with only minimal restrictions, just a cane for a short period of time to provide better balance. I only required an additional 3 weeks of PT. Within just 2 months, my quality of life was back into full swing. I even was able to return to my freelance travel and taught a rehab class at Walter Reed Medical Center just 4 months post-op. My thanks goes to Provant. As a rehabilitation nurse educator, I have taught many modalities and interventions to enable patients to recover. I've even had my own recovery challenges with my knee replacement. Presently, I am the primary caregiver of my 90-year-old mother who's had recent neuro and orthopedic events. I have taught her how to use a rolling walker and to transfer into a shower chair. This type of care would not be possible unless I had full function of my knees. And even though it's been over 4.5 years since my last replacement, I am still very grateful for my mobility and my ability to care for her. My quality of life is still in full swing. I stay busy with my freelance educator work, dancing, being Mrs. Santa, and help raise funds for the local Florida veterans. What I learned during my journey is this: if you are a patient or clinician and need pain relief without opioids, consider Provant. I used it, it worked, and I would use it again.